Welcome to Communication Strategies that Support Resident Safety, produced by HCIS Voller Insurance. Communication is one of the cornerstones of quality resident care and is the necessary component of clinical decision-making, compassionate care, and critical thinking. Effective communication is clear, concise, complete, organized, timely, and respectful. Effective communication ensures that the resident, family members, providers, and coworkers receive information in a manner that is easily understood. Structured communication processes support complete and organized communication between healthcare team members. DAR and SBAR are two examples. DAR represents data, action, and response. Data includes both subjective and objective information. SBAR represents situation, background, assessment, and recommendation. Communication must be two-way to be effective. Good communication ensures that the recipient has received the intended message from the sender. We all know, however, that what a sender sends in communication is not always what a receiver receives. Age, communication barriers like vision, hearing, language, lack of attention, and distractions can all impact the effectiveness of communication. Written communication in email and text messaging is one example. Have you ever received an email message that seemed unclear, incomplete, or that left you wondering about the tone or intent of the message or what you were being asked to do? Factors that impact these perceptions include, but are not limited to, words chosen, capitalization, punctuation, colored font, emoticons, and lack of an opening or closing greeting. Business communication should always be written utilizing professional language and tone. Read and reread before hitting the send button. Use spell check and watch autocorrect. A good practice is always to ask a trusted colleague to review. Steps to consider as you plan your response. Ensure that you know the facts, review the details, and the medical record. Check with the administrator or leader on call before responding or follow your designated chain of command process to seek additional advice. Ask yourself if verbal communication would be a better process for communicating about the family's concern. If you are upset, read and reread your communication before hitting the send button. Have a colleague review before sending. If you are angry, consider the 24-hour rule, if appropriate for the current situation. Write the email and save it for 24 hours. In many cases, after 24 hours, you may be able to speak to the person in person or send the message with a softer tone. How verbal communication is received is often impacted by tone of voice, like how words are said, and clarity of speech. An example of a challenging communication situation involves a recently graduated nurse who has taken a new telephone medication for a resident. The provider is speaking in a rushed manner and in an impatient tone. The nurse attempts to read back the order, but the provider cuts her off with another order for a different resident before she has a chance to finish. When she hangs up, she's not sure that she got either order correct. She doesn't want the charge nurse to think that she can't do her job, so she is hesitant to ask for help. It's about resident safety. The orders must be verified for the two residents. The first tool that we will discuss is closed-loop communication. Closed-loop communication is designed to ensure that the intended message has been received correctly. The sender initiates a clear and concise message, the receiver accepts the message and provides feedback confirmation, and then the sender verifies. For medication orders, this process is also referred to as readback communication. MD telephone order. Amoxicillin 500 mg every 8 hours for 5 days for new onset pneumonia. Nurse, for Thelma Peterson, amoxicillin 500 mg every 8 hours for 5 days. MD, yes, that's correct. The two-challenge rule is used when a healthcare professional is concerned about a change in resident condition, medical orders, or care a resident is receiving. The initial concern is ignored. For example, nurse, Dr. Jones, I'm concerned about the pain medication order for Mary Smith. Her last weight was 92 pounds and she has a history of sleep apnea. Dr. Jones, I feel comfortable that Mary needs this dosage of medication for the pain she is experiencing. Nurse, Dr. Jones, I agree that Mary is uncomfortable and needs medication for pain relief. However, in the past, she has received a similar ordered dosage and required medical treatment in the emergency for room for unresponsiveness. Dr. Jones, I would like her to have the ordered medication. If you are still uncomfortable with the order, You have a professional responsibility to advocate on behalf of the resident and follow your facility's chain of command policy. CUS is a 3-step process used to gain attention for a resident safety issue. Number 1 is I'm concerned about. No response or still concerned after the response. 2, I am uncomfortable and why. No response or still concerned after the response. 3, this is a safety concern and why. All staff should have the authority and responsibility to stop the line. Takeaway communication strategies to support effective team communication. Communicate with team members in a brief, clear, and timely format. Seek information from all available sources. Verify and share information. Practice communication tools and strategies daily. Thank you so much for your time. For questions, please contact Cindy Siders, who's our executive consultant. Have a great day.